Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today we shall treat the topic, why does measles kill some children? Measles usually, like every virus, wants to propagate itself. Everything, almost everything. But they don't have the necessary apparatus to propagate themselves. So the problem is now that they parasitize human or any favorable host. The host inconvenience, it could result in death and it may not. But we find that measles has now, since the pandemic, COVID-19 pandemic of 2020, has now started rising, increasing in incidence. And as such, it is very necessary for us to understand and acquire more knowledge on why some people will have it, and after a brief period of 10 days or more, they survive, whereas some children will have it and die. The reason for that is what I shall expose in this video. So if you like what you seeing and you want more quality production as well as knowing when it is out, press the subscribe button. And if you like it, press the like button. Subscribe and you will continue to have top-notch quality production from me.
Why does measles kill some children? Outline, background information, objective, introduction, lab diagnosis, researches, vitamin A, recommendation, and conclusion. Background information. There is a noticeable increase in the incidence of measles after the pandemic. The increase in death rate in some countries, especially low-income countries, where the risk of death from measles is highest, continues to have the lowest vaccination rate at only 66. So, I shall make effort in this video to explore the difference and make it very clear to us. Objective: to expose the role of vitamin A in the morbidity and mortality rates of measles, especially in children. The introduction. Measles is caused by virus and possible complications include pneumonia. In 8 studies involving 2,574 participants, they found that there was no significant reduction in mortality in children receiving vitamin A. But however, when vitamin A megadoses was given on each day for 2 days, there was noticeable lower number of deaths from the measles in hospitalized children under the age of 2 years. Measles is a highly infectious disease. Patients are infectious during the acute phase of the illness, and virus is transmitted. So by respiratory disease, it can affect more. The laboratory diagnosis includes the specimen, nasopharyngeal, throat swab, blood, and urine. Tests performed on all patients with clinical features compatible with measles. It's usually the PCR test, and the molecular amplification test, where it's used to really confirm measles infection. Electron microscopy could also be done. It shows us roughly circular in outline and measures 120 to 140 in diameter. Hemagglutinin is present but lacking in neurodermises, unlike other myxoviruses, though it is really not classified as myxovirus. Culture: it can be isolated in normal monkey kidney cell line, forming cynthia in affected cells. It could be adapted to grow in secondary cell line after isolation in primary cell line. You see the appearance up there, that's the Koplik spot, appearance of the face, and also the measles rashes on first day. This is usually, you see the rashes red, white. Then the histology also is useful in diagnosis. So you can take the sample from the lung, the appendix too. Researches from United Nations Foundation. This is a quotation from there. Before a measles vaccine was available globally, 2.6 million people, mostly children, were dying every year from this deadly disease. And immense progress since then were made, and right now it cannot be stopped. It is time for public health leaders and communities to recommend to protecting all children from measles. There's another quotation. To reverse the worrying increasing trend in measles cases and death, countries at high risk need to urgently implement vaccination campaign. Vitamin A, another quote, deficiency is a recognized risk factor for severe measles infection. The World Health Organization recommends a daily oral dose of vitamin A for 2 days to children with measles living in areas where vitamin A deficiency may be present. Measles can reduce serum concentration of vitamin A in well-nourished children to level less than those observed in malnourished children without measles. That's a finding. And LDC 92 also found out that first documented the protective effect of vitamin A on measles mortality. These are proven facts. Retinol concentration have been found to be depressed in children with measles, even in industrialized countries such as the US. The degree of retinol depression is associated with the severity of the illness. Vitamin A, let's talk about it. It's a fat-soluble vitamin that plays an essential role in maintaining vision, body growth, immune functions, and reproductive health. So getting adequate supply of this will prevent all that the blindness, especially you see the eye of children having it, and these are the recommended doses for use. Animal products like meat, fish, dairy, and egg are good sources of vitamin A. So many fruits and vegetables are also rich in vitamin A and can help you meet your needs. The vegetable sources have no fat, so if you are watching your fat. By way of conclusion, the poverty level in developing countries has already put them at a disadvantage. So if I should recommend, the only solution that comes to my mind is for food in developing countries or imported food or whatever to be fortified with vitamin A in order to prevent acute diseases like measles that are ravaging their land. WHO needs to also assist in terms of vaccination because these things are beyond the reach of some of these poor nations. And since the world is a global village and a more virulent mutant could spread to developed countries. So if you like my channel, you can watch more videos on this channel. I have many health videos on my channel.